Thank you, madam, for having me, and good afternoon to your viewers.
Good afternoon there, but good morning here in Ghana. But you've been following the press conference that just ended. What's your reaction? I mean, your initial reaction to what the health minister has said and also the deputy finance minister?
Well, thank you very much. And good morning. I believe that I'm beginning to see a certain posture that seeks to create the environment, the enabling environment that can foster any meaningful discussion. But let me quick to state that the solution in this impasse doesn't lie in press conferences. I think that our key ask or our key demands are not above the roof. It is something that can be contained. I believe that the Deputy Finance Minister has done the arithmetics. If he's done the calculations, realize that our demands is not something that can throw the economy off gear. We think that this is a new government. We need to come together as citizens to help build the economy of Ghana. If the dividends of whatever policy that are being rolled out is anything to write home about, and if it improves the fortunes of Ghana, all of us will enjoy. And we will not do anything to derail that forward march, the attempt by the state to reset the economy. But that notwithstanding, we need to bring to the sharp focus of the employer. We need to bring to the sharp focus of the employer that we will not sacrifice our future, our economic interests, just because we have been appealed to come back. We are ever ready to engage, not in negotiation, but in a roadmap of possible implementation. The proposal that was tabled yesterday was inhumane. We think that it is not a proposal that is supposed to be tabled in a situation as we find ourselves.
Well, David, so at least from the meeting that happened yesterday, you were told that your conditions of service or the agreement that was reached cannot be implemented except in 2026. And you heard that the Deputy Finance Minister indicating that as at now, if they should implement it in its current form, it's going to throw the budget out of gear. At least they have the numbers. They, from where they're sitting, they know the situation in which they find themselves. And so wouldn't you, be a bit reasonable, come to some form of agreement to be able to accommodate government's position on this?
I don't think this is a very good position. I will urge the finance minister respectfully to relook at the figures. What is it in the condition of service that will throw the budget of Ghana off gear? It cannot be said to be true. As far as we are concerned, I think that they need to come clean. They need to prioritize the health needs of the good people of Ghana. They need to prioritize the economic interests and economic welfare of nurses and midwives. And I'm being told that one of the mitigating factors is to deploy retired nurses and midwives. They are more even angry than us. What they don't know is that the retired nurses and midwives feel that they've been let down by the state. Okay, I visit them from time to time, not just individuals, but if, for instance, I can show you a place that they meet every last Tuesday of every month. They meet at Christ the King. Go there and talk to the retired nurses and midwives. Some of them have been affected with occupational related ailments, disease conditions that they got whilst working as nurses and midwives. And they're at home, and their retirement package cannot even buy them the little medications that they need to take.
But David, that's unfair, because I mean, at least the minister says they reached out to them, so I'm sure they have some agreement with them. People need health services. At least you are out of work, and we need people to fill that gap. So if the health minister is finding avenues to help people get that health care, I believe we should let them do that. But in that regard, I mean, you've asked fair questions about what necessarily will put the budget out of gear if your agreement is implemented. I believe that question can be posed to the minister and also other stakeholders who are willing to sit around the table to have those discussions. So are you also willing to come to the negotiation tables and put those questions to them and at least come to some form of agreement?
We are ready to go to the implementation table, not negotiation table. I've told you that we have finished with negotiations. These two words are not the same. It must not be used interchangeably. Yes, we cannot block any attempt by the employer to deploy any strategy that will mitigate the effect of our strike. If they want to bring in retired nurses, don't forget that retired nurses are members of GRNMA. That's what they don't know. The retired nurses and midwives are actually members. We have life membership that is open to retired nurses and midwives, and all of them are members. And if they so agree that they will come in as strike breakers, it's up to them. We will not stop them. They are mothers. They can come in and offer those services. After all, earlier in the morning, in our informal discussion, I told you that we have even taken steps to put in some skeletal staffs and other. As late as 3 a.m. Ghana time, I was looking for people to stand in at NICUs and stuff like that to be able to take care of babies, feed babies in incubators and all that, and provide their medications, a job that they thought the doctors would be able to do that they are not able to do. So what I'm trying to let you understand is that we will not stop anybody from deploying any tactics that will improve the system, but they should avert their minds to our demands. We think that our demands are not elastic. They are inelastic demands. It can be accommodated. If you tell me that something that I have negotiated, and don't forget that the condition of service is a living document. It expires in May 2026. So if you are deferring the payment of 2024 condition of service to 2026, when do I go for another renegotiation? Don't forget that May 2026 is another window for renegotiation. These are some of the things that they do to nurses and midwives, and we are impoverished up to today. We will not continue on this tangent. We need to change the narrative as leaders of the association.
Well, David, let's come to the terms of agreement or the bargaining agreement that you reached in the SWAL government. Exactly what can you do away with? At least you need to meet government halfway.
Do away? We cannot do away with anything in the condition of service. My dear sister, listen. I'm sure you have seen the condition of service. Every health worker in Ghana is enjoying that condition of service, and even better. We will not do anything away in that condition of service. In fact, we want to go for wage opener to augment whatever we got. If they have any implementation difficulty, I'm saying that we are prepared to sit down on the implementation table. But the implementation proposal of deferring payments to January is neither here nor there. We will not take that. Who does that? I mean, how do you expect the nurses and midwives to go by till January 2026? And don't you think that it also affects our window of negotiation in 2026? Why do we do this to nurses and midwives? And let me tell you, my dear sister, if there is any time that the employer will avert its mind, will be minded to provide whatever nurses and midwives are asking for, it's now. Are we not in Ghana and we are crying that nurses are traveling abroad? You think those who are in there are bad to travel? They are not bad to travel, my dear sister. They can also travel. It's out of goodwill.
So at least, fair point. Can implementation be done in stages at least?
Absolutely.
Not all of them.
Reasonable people. We can stagger the implementation, and we are open to that. But it must start this year. Some of the items within the condition of service are not new. Some of them were even paid, by the previous administration. The point is that it's just an enhancement. An enhancement is not so much. So if you want to stagger the implementation, say, next month we'll pay this, in 2 months we'll pay this, it will make sense to us. But if you tell me you are deferring the entire payment of the conditional service to 2026, what does that supposed to mean? Are they deferring their salaries to 2026? It's unfair. And we can only do this to nurses and midwives because we think that they are all females and they don't have anybody to... Look, my dear sister, we don't wield guns, we don't wield cutlasses, that's why they don't fear us. I'm sure they can't do this to any of the security agencies, all right? Because we are essential service. No nurse in Ghana receives a rent allowance. No nurse, no matter your rank, receives rent allowance in that country. No nurse receives accommodation allowance. Look at these young nurses and midwives. They are breaking their back, and they live only on that small what do you call that poultry salary. And the little enhancement that this condition of service will bring, you are deferring to 2026. What do you take us for?
So, David, how soon can you meet government on your next line of action?
If they want to meet us today, if they want to meet us now about a reasonable implementation proposal, we will avail ourselves. But this type of implementation proposal is neither here nor there. We will not accept it.
I'm also hearing that the other nurses who are not necessarily part of your association are also in solidarity withdrawing their services. Have you come across any of these nurses?
Absolutely. I've told you already that their members actually defile their orders because they are thinking about their future. They are thinking about their economic interests. I've told them, I have done this job for 24 years. So if I'm telling you that your future is bleak, you must believe me. They have realized that the action that was being taken by their leaders was not going to inure to their economic interest. And right from day one, they defiled those orders. I hope you understand. But now, the leaders are coming back home. The chicken is coming back home to roost because they realize that they took a very poor and undecisive decision. How can you align with government? No union leader worth his salt must align with the employer. It makes no sense. Politicians will come and go. 4 years, they will go for their ex gratia. When it comes to the payment of ex gratia, they will not say that they are deferring to 2026. What did they take nurses in Ghana for?
Right. So, David, which associations are these?
Well, I'm not going to give you any names, but as far as I'm concerned, I can tell you that all those, or some of those who said they were not going to be part to this strike, although officially have not issued a statement, we know how they are clandestinely asking their members to join the strike. And their members are on them to issue a statement. And I can tell you that there is a regional branch of one of those associations, which I will not glorify by mentioning their name, that has asked the members to stay away from work because they feel overburdened by the strike. You see, initially, the posture of the ministry was not helpful. They thought that they could rely on these colleagues of us as strike breakers. We have been around for a very long time, and therefore we understand industrial relations and the fact that people could be used and induced as strike breakers. We are not perturbed by that, but we felt that the commitment that we have with our people, the people that gave us their mandate, we represent their interests. And so long as we represent the interests and only the interests of nurses and midwives in Ghana, we really think that we are on the right course. And I think that the employer must do the needful. We are not asking total implementation of everything. We're saying that we are reasonable people. We are ready to sit down and at the implementation table so that we can stagger the payment. We are ready to do that.
Right.
But to defer the payment is not something we will entertain.
Right.
Not today, not tomorrow.
All right, David, I'm grateful for your time on our desk. David Tinkwan is General Secretary of the Ghana Registered Nurses and Midwifery Association.